Now, for more on this is Ted Lieu, who represents California's 33rd Congressional District. Thank you so much for taking the time to speak with us.
Thank you, Alex, for having me on your show.
You recently tweeted about how some of the things that we are seeing and hearing in the midst of this coronavirus pandemic are reminiscent of what happened all the way back in 1882. For folks who are not familiar with that particular chapter in American history, can you fill us in on what happened at the time and make some of the connections to what you are seeing and hearing today?
Well, thank you for your question. Unfortunately, we have seen a rise in hate crimes against Asian Americans because of this pandemic. Asian Americans have been harassed, assaulted, spit upon, and in some cases stabbed because of people's view that somehow Asian Americans are transmitting this virus. That's just not true. This virus knows no race or ethnicity and affects everyone. And this is something that has affected Asian Americans throughout American history, their discrimination in terms of when there's a threat. You have people acting out against Asian Americans, from the yellow peril hysteria to the Japanese American internment, to the Chinese Exclusion Act and the murder of Vincent Chen. We do see violence directed against Asian Americans during these times. And it's my hope that as we educate people, more and more Americans will understand the problem and not engage in such activities.
And you mentioned the murder of Vincent Chen. Again, this is an incident that perhaps not all of our audience is familiar with, and forgive me if I get any of the details here incorrect, but this was an Asian American man who was mistaken for being Japanese American. He was not, and he was brutally murdered, beaten up in Michigan by a father and son, which might make some people think about what recently happened with an African-American man who was running. I'm curious, what do you feel like as an elected leader and as an Asian American at this juncture in time? What can you say or do to counteract these impulses, especially the ones to violence, which I think many people will find the most disturbing?
One way is simply to highlight this issue. This pandemic has affected all Americans, and many people don't walk around thinking about hate crimes. But now that you highlight it, it makes them think about what could happen to people. And that's one of the best ways to prevent it from happening, is to get the community engaged. And we have seen the community come together, and you see lots of people across America of all races speaking out against hate crimes. And the way we beat this virus is by acting together as one nation. And my view is, at the end of the day, we're all Americans, and we're going to prevail.
That is a lovely notion, that we're all Americans in one nation, but I don't think you have to look much further than Twitter, where you are very active, to see that it doesn't always look that way. And in fact, I believe it was in response to a tweet that you put out about this day against bullying in honor of Vincent Chen, where people were less than kind, to put it very mildly. And sometimes I have to say, when I hear the debate, and especially when it comes to trying to connect coronavirus to Asian Americans, specifically to Chinese, it feels to me like the battle between those who feel that the world is flat or the world is round. And, you know, now with hindsight, we can look pretty clearly at it and know that the world is round, but at the time, people were pretty firmly entrenched in their camps, and I feel like some people are firmly entrenched in their camps now. Do you feel like you are actually able to change any minds on this front? And if so, how? How do you do it?
Thank you for the points you make. It is true there are some people for which you simply can't change your minds, but the overwhelming majority of Americans are good people, and they understand that this virus does not know any race or ethnicity. The way we beat this virus is through testing, tracing, and isolation, and it's based on science and medicine. And that's how we're going to win, and not through division or hate. And most Americans understand that. And that's why I have great hope for our nation and for what we've seen so far, which is we have been able to flatten the curve, and we have taken a lot of steps to reduce the spread of this virus. And we're getting remarkable compliance among the American people, listening to public health officials. And that's really how we win.
But you have also suggested that it might not be a bad opportunity to look toward what other nations are doing, and considering and including including your homeland of Taiwan. And you've asked that Taiwan get more involved in the discussion at the World Health Organization. Can you share with us what you are seeing there, what you think Taiwan did right in its approach to this pandemic, and what we could learn from that?
Yes, Taiwan got it right at the early stages where they said that this virus can be transmitted among humans. Taiwan has also done a really good job of continuing to suppress the virus, even though they have a lot of people living very closely together. And we can learn a lot from Taiwan. And I think that the World Health Organization needs to include Taiwan as an observer, which they did in the past. I've been calling on the WHO to do that, and I'm very pleased that the head of the WHO has now made a proposal to include Taiwan, and hopefully that's going to happen.
But Taiwan and many other countries in Asia, they have a different government than we do here in the United States, a country that was born in many ways on this principle of, freedom to express oneself. I'm curious, as a member of the U.S. Congress, do you ever find that perhaps some of the values that we treasure so much as Americans make it difficult to wrangle control of what is happening with this virus, maybe in the same way that other countries have?
I am disappointed in the conduct of our president. He, for example, has been promoting snake oil cures like hydroxychloroquine, which multiple studies show has no effect on COVID-19 patients, and in fact can be quite lethal to a certain subset of patients. We see the president also, with his administration, putting out federal guidelines for states to follow before they can reopen. And then before the states can even meet these guidelines, the president is egging on protesters, asking for these stay-at-home orders to be lifted, even though that would violate his own standards. That's really a ridiculous way to govern. And so I wish that our president would act more rationally and rely on science and public health. And if he's going to issue guidelines, he needs to really follow his own and not ask states to violate them. Otherwise, he should just rescind those guidelines.
Congressman Lieu, I'm curious. I know that you and your colleagues recently voted to some changes in terms of how you conduct yourself as a body, and a lot of it involves relying on technology. You yourself, a former computer science major, what do you make of how Congress is operating now? What can you do remotely, and what are some of the things that are just really tough right now without being in person?
I have one correction. I'm a computer science major. It was a very difficult, a traumatic experience for me, but I did learn a lot getting that degree. And we're in the 21st century, and Congress is now slowly using the tools, technological tools, to be able to operate remotely. So it was only until very recently that we could even hold virtual hearings. We had to make a rules change to allow that to happen, because what the rules said is we had to physically meet in person. With the new change, we can now hold committee hearings remotely. There's technology that allows us to do that. And I think you're going to see now a lot more hearings being done on a bipartisan basis. And that's a good thing.
If you don't mind my asking, I know this is somewhat of a personal question, but I think it's one that many members of our audience would be interested in. I know that when several of these key congressional votes have happened, that you have not participated. My understanding is that you yourself have a certain personal health conditions, and you are trying to protect your own safety, which I think many people can understand. Can you talk a little bit about how you personally right now are balancing your responsibilities with the risks that we know are out there?
Sure. I had a cardiac procedure in December. I am still taking blood thinning medication. One of the things that this virus does, for some unknown reason, is in a certain subset of people, it causes blood clots, which in my case would be extremely bad. And so my cardiologist has recommended that I don't travel unless it's absolutely necessary. And so I'm going to follow that recommendation. The blood clotting medication, I will go off in a few months. But I am thankful now that Congress has passed a rules change that allows for remote proxy voting. And so all future votes, I should be able to participate in. In terms of working on constituent issues, our district office remains open even though it's physically closed, all our staff is working remotely. And so we're still handling constituent issues and constituent matters. And if anyone has any issue with a federal agency, please contact me or my staff, and we will assist you.
Congressman Ted Lieu, he represents California's 33rd District. Thank you so much for your time.
Thank you, Alex.